gratitude. I choose love. I pray with faith. I express myself with authenticity. I believe in community. I am a daughter. I am a friend you can confide in. My best friend is my work. I am an author. I am a mental and emotional health practitioner with a degree of PGDIC, certified in psychotherapy, rational emotive behavior therapy, applied transactional analysis, and breathwork for emotional well-being. I served as a human resource leader, presently founder of Dineessha Emotional Healing Foundation, 29 plus years of professional experience. My greatest qualification is not only what I studied, it is what I have lived. Trauma deepened my compassion. Healing became my purpose. Welcome to Dineessha Emotional Healing Foundation. How many times have you really heard someone say, I'm feeling lonely? I feel, there is a mental problem with me. Or maybe, I'm feeling anxious, maybe before my exam. I think something is wrong with me. Or perhaps you have heard somebody say, I don't want to see a counselor, because people will judge me. They will think I'm mentally ill. Well, what if I told you that we have been using the words emotional health and mental health, interchangeably when they're actually not the same? Understanding this one difference can actually, completely change how we understand ourselves and others. Hello everyone, I'm Pinky Kansara, founder of Dineessha Emotional Healing Foundation. Welcome to our very first conversation. Why does this confusion really exist? Because nobody teaches us emotional education. We learn mathematics, we learn science, we learn history, we learn languages, but nobody teaches us, what to do when we feel lonely, overwhelmed, ashamed, heartbroken, angry, disappointed, or maybe how we face, failures or setbacks. So when emotions become uncomfortable, we immediately assume something must be wrong with us. But feeling emotion is a part of being human. Not every uncomfortable emotion is a mental health disorder. So let us understand emotional health. Emotional health is your ability to recognize, express, and regulate your emotions. You can feel sad and still be emotionally healthy. You can cry and still be emotionally healthy. You can grieve, feel disappointed, feel lonely, feel rejected. Every one of these emotions belongs to being human. It's the question isn't about that, do I have emotions? The question is, what do I do with them? Do I acknowledge them? Do I suppress them? Express them or process them? That makes the difference. Whereas mental health is much broader. It influences how we think, how we feel, how we behave, how we make decisions, maintain relationships, work, and function in our everyday life. Sometimes when emotions remains ignored for prolonged period, or when several, let's say, biological, psychological, environmental, and social factors interact, it may contribute to mental health conditions that require professional assessment and treatment. This is why prevention is so important, not because every emotion becomes a disorder, but because emotions deserve attention before they begin affecting our overall well-being. And this is exactly why the Dineessha Emotional Healing Foundation, a non-profit initiate, was created to help people understand emotions before they become crisis, to remove the stigma around seeking help, to create emotionally, let's say, well-being, accessible, understandable, and stigma-free. At the Dineessha Foundation, we believe emotional well-being is holistic. Because through our conversations, we will explore an integrative approach that brings together, let's say, emotional education, psychological perspective, of course, cognitive understanding, and spirituality, helping individuals understand not only their emotions, but their overall existence and journey to inner well-being. Because emotional education shouldn't begin after suffering, it should begin much earlier. So before I leave you today, I'd like you to practice one simple exercise this week. Whenever you notice yourself saying, I'm not okay, pause. Instead of judging yourself, ask yourself one question. What exactly am I feeling right now? Not what's wrong with me, but what am I feeling? Maybe you are, disappointed, maybe you are lonely, maybe you are overwhelmed, maybe you're just exhausted. But when we learn to name an emotion, we take the first step towards understanding it. And understanding almost always comes before healing. If today's conversation helped you see emotions differently, please share it with someone who may need to hear it, because one conversation can change one life. Thank you for joining me. Until next time. And remember, every behavior has an emotion behind it. Before you judge, choose to understand. Until next time, feel, heal, transform. Thank you very much.